Welcome to Mental Healthy, the podcast where we share stories of the professionals and experts worldwide working in the mental health field. Here's your host, Dr. Kenyon Knapp.
Welcome, everyone, to the Mental Healthy Podcast. I'm glad to have you with us here today. I've got a great friend here today, Dr. Jennifer Smith Ramey, and we've known each other for a few years, but the listeners don't know you. So could you maybe share a little bit about yourself?
Yes, absolutely. Thank you so much for having me, Dr. Knapp. I'm so excited to be here this morning.
Oh, sure.
I'm Jennifer Smith Ramey. I work at Horizon Behavioral Health based out of Lynchburg, Virginia. So we are a public behavioral health organization. We serve mental health, substance use, and individuals with intellectual disabilities. I know we'll dive more into that in just a few minutes. A little bit about my background. I'm a counselor by training. I received my graduate degree from the University of North Carolina at Greensboro in 1996 and worked in public behavioral health for about 30 years. So my heart and soul is really in serving communities, particularly underserved and marginalized populations. I went back to school here at Liberty, had a wonderful experience in the counselor education and supervision program. So completed my doctorate 2 years ago. So in addition to working in my organization Horizon, I also am an adjunct professor of counseling at the University of the Cumberlands, where I get to train future counselors, and I also get to work with doctoral students. So it's been very exciting, very much.
That is great. Well, you mentioned that you've been with Horizon Behavioral Health for a while. Can you tell us a little bit about Horizon Behavioral Health and its mission and vision and what it does for the community?
Yes, absolutely, would love to.
Yeah.
Horizon has been serving the Central Virginia community now for over 50 years. We began back in the 1960s through the Community Public Mental Health Act back then. We are the single point of entry for all publicly funded mental health, substance use, and intellectual disability services. And we serve the entire age range from individuals as young as 2 and 3 years old through the geriatric population. And Horizon provides a continuum of services. At the low end, we have prevention services where we work with schools, we run campaigns to increase awareness of mental health, substance use issues, suicide prevention. We work very closely with school partners and community stakeholders to do prevention activities. And then in the middle of that continuum are our outpatient services. And those are held at multiple locations in Central Virginia. Our main office is on Langhorne Road in Lynchburg. And then to increase access for the community, we have satellite clinics in Amherst, Bedford, Appomattox, and Campbell counties, where we have counseling, case management, and medication management as well. We take a very team-based wraparound approach at Horizon to help our clients meet their needs.
Well, that's great. I know some of the, what do you refer to them as, outpatient offices or?
Yes, the satellite clinics or wellness
Satellite
centers.
clinics.
Yes.
Yeah, I know you helped somebody I knew in the Bedford satellite clinic and with substance abuse struggles, and that really meant a lot to them. I know it really did. So.
Yes, and we want to have a presence in the community. Our goal is to make relationships in each of the communities because each community is a little different. The Lynchburg community has, a different culture, different community partners than Bedford, Campbell, and Amherst. So we feel that if we can have wellness centers and clinics embedded in those communities, that'll help us facilitate relationships with the citizens and community members.
Absolutely. Now, you mentioned you've been around for over 50 years. And I'm sure the organization has changed and grown and evolved in different ways. Could you tell us a little bit about that? And also, how big is Horizon anyway? I know you're pretty big, but I have no idea exactly.
We are very big. We employ over 600
Wow.
employees,
Yeah.
and we continue to grow and to expand. And that's one of the roles that I have at Horizon is I assist with grants and program development. So we're continually looking at community needs. The hospital system here, Centra, every 3 years does a community health needs assessment. And they just finished one and published that. And that really is where they survey community members directly, so they get direct data, and then they look at secondary data such as overdose data, EMS responses, and then they take that report and they really aggregate it and say these are the top community needs. And we keep a really keen eye to those community needs because that's important for our mission that we match the needs are in the community. So with that said, we do need to be nimble as a public behavioral health organization. I'll give an example, the opioid overdose epidemic. You mentioned you knew someone that received substance use services. That was a huge crisis for the not only here in Central Virginia, but nationally. And we needed to scale up our treatment and recovery services to be able to meet that need. So that included expanding more intensive substance use services because many individuals needed to come in more than just once a week to be able to get off of drugs and alcohol. So we really had to look at what can we do to provide more intensive services. That could be groups 3 times a week for 3 hours a week, including peer recovery specialists. So those are individuals with lived experience. And there's an ample amount of research that says including peers within the treatment continuum can really improve outcomes. So we scaled up our peer workforce as well.
That's great. Well, it sounds like you make a lot of really data-driven decisions. It's not just willy-nilly.
Absolutely. I mean, certainly looking at anecdotal information, can be helpful, but we are very data-driven. We're focused on outcomes as well. So we want to use that data to inform our programming. And we take a multi-method approach. So certainly we're looking at quantitative data, overdose numbers, EMS calls, but we're also looking at individual experience, so client satisfaction surveys and meeting with our clients to hear what they liked about services and what they thought could be done differently is helpful in our decision-making process too.
That makes a lot of sense. Well, you mentioned you have over 600 employees and you have all these satellite offices and everything, and you've touched on this a little bit, but could you tell me a little bit more about some of the key services you have and some of the populations that you reach out to maybe who need services more than other groups?
Sure, absolutely. And being a primarily public serving agency, we want to outreach to those that are marginalized and vulnerable populations. So often our clients have a lot of barriers to treatment. And I can talk about some of the barriers and ways that we try to address those barriers. So certainly the population of individuals that are suffering with addiction and substance use disorders is a big focus, as I mentioned, with the opioid epidemic. And then when COVID was overlaid on top of that, we really saw a perfect storm of a substance use crisis because individuals were overdosing, using at higher rates. We saw an uptick in adolescent mental health issues too. So that's been another focus for us in recent years. The data on school mental health has shown that there's a huge increase in depression, suicidal ideation, and anxiety among school-age youth, particularly the high school youth. Our community does youth risk behavior surveys as well. So we, again, use that data to inform populations and where we need to target services. So one thing we did to outreach to the youth was we partnered with multiple public school systems in our community. Lynchburg City Schools, for example, Bedford County Public Schools, Amherst County Public Schools, to embed counselors in the school settings. And we found that that increases access because there are a lot of barriers for kids coming to an outpatient clinic.
That's
They
right.
may not be able to drive if they're young, for one. Second, they may have parents that are working one, maybe two jobs. Third, they may not have transportation at all. So we found that if counselors are in the schools, they can meet and make a good therapeutic connection and work with the kids. We also put case managers in the school as well because we recognize that a lot of the issues that our youth are facing are complex and multifaceted. So they may be facing depression or anxiety issues, but they may have issues with stable housing. They may have homes where they don't have enough food to eat. So having case managers that can be in the schools and assess those needs and then help link the kids and the families to resources is critical.
Wow, that makes a lot of sense. I don't know if I've ever shared with you before, but I actually did that in the past myself, where I was a school-based community mental health counselor. And you're so right. Like everything you're saying, I'm like, yes, yes. Because, teenagers are just reluctant and self-conscious and all this. But when they know you, like you work in the school, there's that rapport.
Absolutely.
And then they're willing to come talk to you instead of feeling weird about seeing a counselor.
That's absolutely right, and I think that gets at an important point that we see, and this is also prevalent in the data, the community health needs assessment data, for example, is stigma. Unfortunately, there is a stigma surrounding treatment for mental health and substance use disorders. So that is another factor that prevents some people from coming to our offices for services. They don't want to be seen, as, oh, I'm crazy, or why, I need to tough it out. So there are still some messaging that, we're slowly trying to change in our field. And I think we've made some inroads in reducing stigma, but that's absolutely still present. So embedding services, like you said, in the schools, that they're less likely to say, oh, I don't want to go, talk to so-and-so in an office. It's like, no, I, want to see, Miss Hannah. She's here at the school and she's my counselor.
Yeah. I'll get this a little more personal today, too, and share a thing or two, and it relates to Horizon. In the past few years, my wife and I have been foster parents as well. And one of the really cool things is some of the kids we fostered were fostering with us because the parents had substance abuse challenges and addictions. And they received services from your organization. And now those kids are back with the parents and things are going better and all that. So I can speak from personal experience how your organization has helped people in our community. So I want to say thank you for that, because these kids, of course, are going to turn out better with stable parents.
Absolutely. No, thank you for sharing that. And that's an important point of our work, too, is that we really try to take a family-focused lens. I mean, many counseling models are focused on individual therapy where you're meeting one-on-one with a client, but we really feel that it's important to offer family-focused services. And one example of that would be our partnership in Bedford County. Bedford, back in 2019, developed a family treatment recovery court. And so that court is designed, and I think you already know this, but for your listenership, that court is designed to help parents that are struggling with substance use to where their children may be at risk of removal from home and placed in the foster care system. Historically, in the United States, those numbers have just increased over the years. So recovery courts were designed to be an alternative to couple the accountability of the court process and child welfare organization with treatment. And we've seen really wonderful success in that recovery court with being able to reunite parents and children. And every time that happens, I mean, it's a beautiful thing for our community, for the clients and our partners. So we love the recovery courts. That's another model that has a rich history in proven and effective outcomes.
Absolutely. Yeah, I know it's helped the community a lot. So, I tell you, you mentioned a number of different programs. We talked about substance abuse and some of the mental health programs and all. Could you mention maybe a few of them that have had a significant impact that maybe more so than some others?
Sure, absolutely. One that comes to mind, we have a rural health outreach program, and this was funded through the Health Resources Services Administration, so federal funding that we received 4 years ago. So we applied for this funding right during COVID, and we were very pleased to be awarded funding. We actually partnered with a research professor in your department to do the evaluation. So that's been a wonderful Liberty University community partnership. And with this program, we specifically outreach and have provided services to over 150 adults with serious mental illness. And these would be illnesses including your schizophrenia, spectrum disorders, major depressive disorder with psychosis, and bipolar disorder with psychosis. So that's what was our target population. And we know that those individuals on average die about 25 years earlier than the general population. So again, looking at the data, we felt like we needed to target that population and provide services that will help them stay out of the psychiatric hospitals, will keep them in the community, and allow them to live their very best and healthiest life, whatever that looks like for them. So in particular, we're using an evidence-based model called Illness Management and Recovery, or IMR, and it's a combination of psychoeducation, cognitive behavioral therapy, motivational interviewing, and it's tailored to meet the needs of each client because every client that has schizophrenia doesn't have the same goals, may not have the same symptoms, may not have the same needs. So we've been very pleased with being able to provide services to over 150 adults over this 4-year duration of that project.
That's great. Yeah, there's so many needs out there, and it's neat to hear how you're doing it. Now, you've already touched on the school-based counseling and then the substance abuse, which I guess could be older folks or teenagers. But I know your programs focus on both adults and children. Could you maybe delineate a little bit of how you try to focus on each group?
Yep, absolutely. And that's very important that we use a developmentally appropriate lens for our services. And I can certainly use substance use as an example. We have an evidence-based model called Community Reinforcement Approach, or CRA. You know, we have a lot of acronyms in the mental health field. So CRA was first researched and designed back in the 1970s for adults with alcohol and drug use disorders. And the purpose of that model is to help individuals, at that time adults, replace drug use with healthy and positive behaviors and activities called prosocial activities, and then increase skills, positive communication, and problem-solving skills. So that model was determined to be very effective. It was based on a 3-month treatment duration. And then the researchers in the 1990s realized we need an adolescent, a child adaptation, because at that time the data was showing an increase in cannabis, marijuana use. So the government piloted a series of studies across the United States called Cannabis Youth Treatment Studies. And out of that research, the adolescent community reinforcement approach was deemed evidence-based. The adaptation there was that we provide family sessions and work with caregivers. So in our adult model, we might be working with a partner, a spouse, a significant other, because partners can play an important part in recovery.
Yeah.
With our adolescent and child program specifically, we want to work with caregivers and we want to work with them one-on-one. So we're meeting their needs, providing them support. And then we want to do family focus session where we're trying to improve that family relationship, because oftentimes by the time that youth has come through our door for treatment, it's very strained. It might be very chaotic. So we really want to developmentally bring in parents and caregivers to help that family system. And we see that pretty broadly. We see a caregiver can be a biological parent or parents. Oftentimes there might be grandparents that are helping raise children, foster parents.
Yeah.
There could be any other supportive adult that's willing to participate in therapy. So we very much try to tailor those caregivers and bring them in to meet those kids' needs.
Yeah, that makes a lot of sense. You know, I'm sitting here thinking as you're talking, you're mentioning all these different evidence-based programs that have all this research backing them up. And if I were a listener, I'd probably be going, oh, maybe I'm in a private practice or another mental health large community setting or something like that. Is there a website for Horizon Behavioral Health that people could check out and maybe learn more about these programs?
Absolutely. So we have a website. It's www.horizonbh.org.
Okay.
And our array of programs and services are listed on that website for more information.
All right, horizonbh.org.
Yes.
All righty. Well, let's have you all check that out. And then also we're going to take a quick break and hear from one of our sponsors. Hey everyone, this is Dr. Knapp. I wanted to tell you about Empower Counseling PC. It's a Forest, Virginia-based counseling agency that serves clients in all areas of mental health with in-person therapy sessions or telehealth within the state of Virginia. With 27 counselors, a psychiatric nurse practitioner, and an eating disorder registered dietitian, their mission is to treat the whole person. They specialize in eating disorders, postpartum, play therapy, PTSD, substance abuse, infertility, grief, marital issues, and so much more. Please visit them at www.empowercounseling.info to learn more about their services and their compassionate team. Now back to the podcast. Well, access to mental health care is a major concern nationwide. How does Horizon work to reduce barriers and improve accessibility for those in need? You've touched on this a little bit, but I know, like here in Lynchburg, you know, is probably in my opinion, a pretty common medium-sized city in America. But I know in the region around here, there's a few spots that are really high need. How does Horizon reach out to those folks?
Yeah, that's absolutely true. And again, that aligns exactly with what we see in the community health needs assessment. Transportation and access to mental health and substance use services is always in that top 5 in terms of list of needs. So that's exactly right. So one thing about COVID, I'd say a small silver lining is that COVID opened up this opportunity for telehealth.
Yes.
And we had some telehealth prior to COVID. We had telepsychiatry, where clients could meet their medical provider to get an assessment for psychotropic medication. But we really had not done counseling or case management outreach through telehealth or virtually. The pandemic required that we were very nimble. Within, I think, 2 weeks, we had to transition and begin providing virtual services. And we found that has really helped increase access to a population of folks that were previously underserved. And you're exactly right. Lynchburg, because of its size and resources, it has a bus line, so there public transportation. Our outlying counties in our catchment area do not. So access is more challenging in those counties. So telehealth has helped. Now, that said, there are areas in the community where broadband access is challenging. So it's not a panacea. It's not, can't
Yeah.
help every single client.
Yeah.
So what we also have done is increased our community-based services
Okay.
to where we have trained licensed staff and case managers that will go into the community to meet clients in their homes, in schools. We've talked about that, in probation offices and child welfare offices. We want to go where they are. We want to reduce that barrier of transportation. We have a whole team called an Assertive Community Treatment Team, or ACT team, that they are completely community based. And that's a great model, again, very rich in the evidence base. And they have a psychiatrist, they have an employment specialist, substance use specialist that provides services fully. I think it's like 99.9% in the homes
Oh,
and
wow.
the community.
Yeah, that you're right. That definitely reaches a population that probably wouldn't receive services
Absolutely.
otherwise.
Absolutely.
So that's great. Well, I tell you, I know from personal experience that Horizon partners with a lot of organizations like Liberty, and there's those multi-million-dollar federal research studies that you're involved with some of our faculty. But I know you also partner with a lot of other groups in town. You mentioned the schools already, but you also work with other local organizations and law enforcement. Could you tell us about that?
Absolutely, absolutely. And at Horizon, our philosophy is, we want to leverage shared resources to achieve a common goal of health and wellness for our community members. So it's very important that we're partnering with our stakeholders. A wonderful stakeholder that we partner with is law enforcement. And I can give an example of some programs that we do collaboratively with our law enforcement
Sure.
partners. One is Crisis Intervention Team, or CIT.
Okay.
And this is where law enforcement and first responders are trained to be able to recognize signs of mental health or substance use crisis, and then are trained in de-escalation and assessment and triage. When they encounter clients in the community, maybe they get called to go out to a home or to an event in the community where there is a crisis situation, a CIT trained officer can help to de-escalate that with the goal of avoiding ultimately incarceration or punitive consequences versus a treatment approach.
Sure.
So we found over the years the CIT program has been very effective in reducing, unnecessary jail or punitive consequences for individuals that just truly need acute mental health or substance use treatment.
Yeah.
A recent expansion of that is a grant that Lynchburg Police Department, LPD, received about it was 2 years ago,
Okay.
called a co-response program. And this is a wonderful program. It really extends that CIT model because it pairs a trained Lynchburg police officer with a trained mental health clinician,
Okay.
and they go out together when there's a call for an individual in crisis. And so they're there on scene working in tandem to be able to assess, to refer, to triage, and to hopefully manage that crisis at the lowest level possible. So that's been a wonderful opportunity to really look at, again, those community needs. How can we reduce jails, and legal involvement for clients that really need treatment at the end of the day?
Yeah, that makes sense. I just think sometimes people with mental health struggles can be a threat to themselves or other people. And at that point, having a police officer there to be able to, you know, provide more forceful intervention than a counselor would do is probably a nice ability.
It's a nice balance. It
Yeah.
truly is, because you're absolutely right. There are situations where just the one-on-one verbal de-escalation isn't going to meet that client's needs. So sometimes clients do need to go into a psychiatric acute inpatient treatment for a period of time to stabilize. So having that partnership with the police can help make that the safest for the client and the community, and then also the very best experience for that client too when they're in crisis.
Yeah. This probably gets into a lot of sticky wicky situations where, the line between what is a psychiatric emergency and what is criminal behavior becomes a little bit of a fuzzy line, but that's probably for another podcast.
Yeah, I mean, we could probably do a whole podcast just on that. My dissertation here when I came through the Liberty program was on treatment drug courts and drug court judges. So I spent a lot of time talking to drug court judges across the Commonwealth of Virginia. So you're right. I mean, there are certainly different ideas and different approaches, and it can be somewhat of a fine line between holding an individual accountable versus saying, okay, this individual needs treatment, and where is that line? What's in the best interest of the client? And then you're also balancing safety of the community with those decisions as well.
Yeah, true. Well, let me sort of turn the corner here a little bit. You mentioned that Horizon makes a lot of data-driven decisions, and things change over time. When there was COVID, there were certain needs, and now that's passed. I know Horizon is also adapting and evolving to meet the community needs. What are some of the innovative approaches or maybe new initiatives that Horizon's been doing lately?
Absolutely. So I'm glad that you asked.
Yeah.
One new initiative that we're very, very excited about is our Crisis Receiving Center.
Okay.
And this will be a regional center, so it will serve certainly our catchment area, but even beyond. We are breaking ground this year, so very excited. It's been a years of planning and securing funding, but it will be a facility where we can assess, we can embed police department, do those assessments there at the crisis center versus individuals having to sit in emergency departments, which can sometimes take hours, if not days.
Yes, it's terrible.
Before they can get appropriately, and that's through no fault of anyone at the emergency department. That system is not really designed to have an embedded crisis center within an emergency department. So our receiving center will be able to do those assessments, when safe and appropriate. Obviously, if a client has a medical need, they would need to go to a hospital. So they'll need to be assessed for that. But we'll be able to do assessments there and then triage and link to higher level of care on site at that crisis receiving center. We will also be able to offer substance use detoxification at that crisis receiving center, which is huge because many individuals, particularly in those severe levels of substance use disorder, need to have a detoxification protocol before they can go on to that next level of treatment. So we'll be able to provide that as well in that facility.
Now, is that crisis response center, is that totally Horizon or is that in partnership with Centra?
So Centra is supporting the Crisis Receiving Center, and they actually helped us by giving us the facility where this will be. It will be off of Fort Avenue here in Lynchburg. So they're a big partner with us. And then, of course, our law enforcement, our partners. And then we'll also rely on our other community partners, such as our private organizations and other mental health and substance using organizations too, because we know it takes a village. It takes multiple folks.
Well, and you guys are good at partnering, so you have that village here, no doubt. You mentioned all these different ways that Horizon has adapted to the needs of the community and all. What are some Horizon's goals for the future? I know you make a lot of data-driven decisions, and you've got a long list of data about what to anticipate, although you can't anticipate everything.
This is true.
But what are some of the goals for the future, and how do you see the organization continuing to serve Central Virginia?
Absolutely. So, one of the things that we would like to do is continue to expand our treatment and recovery court. So, I touched on that earlier.
Yeah.
Bedford has a family recovery court that we've had for about 6 years at this point. We want to continue to grow that program and increase capacity. Similarly, in Lynchburg, we have an adult recovery court. So
Okay.
Bedford's is a civil court, it's child welfare driven.
Yeah.
Lynchburg's is a criminal court. So those are individuals that have justice involvement, substance related legal charges. So we want to grow that program. We recently received federal funding in the form of a Substance Abuse and Mental Health Services Administration grant to increase capacity. So we were able to partner with our community again and add a community corrections officer to be able to supervise more clients. So therefore, then we can increase capacity of that program. About a year and a half ago, we also started a mental health court or behavioral health docket here in Lynchburg. And that's the same approach that we want to provide treatment coupled with accountability for individuals that have a serious mental illness and justice involvement. So we really are looking at how can we increase programs that we know have proven outcomes. So we look at
Yeah.
those evidence-based programs and how can we amplify or increase what we're doing, in partnership with the community.
Well, that's great. So you mentioned Bedford and Lynchburg have these recovery courts or substance abuse courts. Are there plans or dreams in the future for other counties in the region to have something like that?
We are hearing of that. So
Sure.
because of the success in Lynchburg and Bedford, several of our other counties and communities are asking questions or saying, hey, we see this is working in Lynchburg. Is this something we could bring to our community? So those conversations are happening, and we are hopeful that we can expand and grow the treatment recovery court model in other localities, certainly.
Yeah. Well, I've known you for a number of years since we've been living here, and I actually graduated the same year with my master's that you did.
Oh, wow.
So we've both been practicing for a while, but I'm sure there's somebody listening now, though. Maybe they're struggling with something themselves, or maybe they're a therapist for people with struggles. What message would you have for them, and how can they take a first step in reaching out? Like maybe if they're local or somewhere else, what would you say to them?
Absolutely, absolutely. So, what I would say is that you're not alone. I really want to send that message that struggles, and again, we talked a little bit about COVID and how that increased a lot of mental health and substance use issues for many of us. So you're not alone. Help is available, and that's a sign of strength to seek help. So really saying, hey, reach out. Reach out. If you're local here, we offer services to our community members regardless of ability to pay. We have a sliding fee scale. We have other grants. We never want pay or ability to pay to be a factor in someone's decision to seek treatment. The first step would be to get an assessment or what we call an intake. And we have walk-in intakes. We have scheduled intakes. We offer that Monday through Friday from 8:30 to 5 o'clock. Our walk-in is at 2215 Langhorne Road here in Lynchburg. And then again, it can be a scheduled intake as well. And to help individuals access those services, that we can also do those virtually. Just that's been a part of our telehealth expansion as well. And I would say this for your listenership outside of the Central Virginia, Lynchburg area, there are resources. 988 has been a big push for individuals that may be in crisis to know that they can reach out, and someone is manning that 988 number 24/7, 365. Another resource, and this is facilitated generally by United Ways, is something called 211.
Okay.
And that's a great place where you can find resources in the community, because sometimes people maybe want help, but they just aren't sure what's out there.
That's true. It's overwhelming, and if they have other conditions that are limiting their ability to process things, that probably makes it harder.
Absolutely.
Yeah,
Absolutely.
Definitely. Well, we are sort of at that point where I want to respect your time and that of the listeners and wrap it up here. But before I go, I always ask everyone sort of a catch-all question. Like, we've covered a lot of ground during this interview, but is there anything else maybe you've got on your heart or mind that you want to share with the listeners before we wrap it up?
Yeah, absolutely. I just wanted to thank you for the opportunity to be able to be here this morning, to talk to you and to talk to your listeners. We feel just so strongly about working with our community and really, the folks at Horizon, one thing that we've seen over the years is that they have a heart and a passion for service. And obviously we're a secular organization, but that doesn't mean we can't be driven by a love for people, a love for our community, and a heart to help those most in need. So I'm thankful for this opportunity to be able to talk with you all this morning.
Well, I feel the same way. It's been a win-win relationship for quite a few years now. And I know there's a number of our graduates that go on to work with Horizon Behavioral Health, and even all the research you're continuing to do with some of our professors is great. So thank you for being here.
Thank you so much for
Dr.
having me.
Jennifer Smith Ramey, and horizonbh.org is the website.
Yes, it is. Thank
All
you
right.
very much.
I'll make sure we got that right.
Perfect.
And thanks for joining us. And thank you, listeners, for joining us as well. We really appreciate it. And we'll look forward to having you with us next time here in the Mental Healthy Podcast.
Thanks for listening to this episode of Mental Healthy. If you want to hear more episodes, please hit the subscribe button wherever you get your podcasts and head to linktree.com/mentalhealthypodcast for all of our social media platforms with the latest mental healthy content. If you have a story to share that relates to what we discussed in this episode or any other episode, please contact us at mentalhealthy2020@gmail.com. That's mentalhealthy2020@gmail.com. Thank you, and God bless.